Hello, good afternoon. My name is I'm here today with Chris Johnson in New York, and we're talking today about vibration training. So Chris Johnson is a physical therapist, 5 times Ironman, a certified triathlon coach, so a specialist on the human body and its performance. And I'm really happy that he's giving today his time to me, that I can ask him some questions about vibration.
Yeah, the body of literature is really emerging, and there's some pretty interesting results, and I thought it would be helpful to just sort of go over some of those studies and what we've learned at this point about whole body vibration training.
My first question is actually about which benefits did vibration training provide you in your own athletic performance?
Where I've been using it in my own athletic performance is to improve my anaerobic power on the bicycle. Okay, and you know, all of the talk is about power these days on the bike, and nearly everyone has a computer when they're racing. So, you know, it's a little bit less important with long course racing, but definitely more relevant with short course racing. And what we're trying to get at is a right frequency. So we know that higher frequency is what's going to trigger this response. So the beauty of this is that you don't need to go and cycle for 2 hours. I mean, you can jump on this machine and do it in small doses. In this particular unit, the HyperVibe is really interesting because it's a pivotal platform. It's not a synchronous platform, and that's an important piece, because when you look at the methodology of all these studies, 30 hertz on a pivotal platform has a much greater effect versus a synchronous. So that's where I've been using it in my own training. And there's also some research that talks about running economy and how it can improve running economy. And again, this is one study that I'm basing this on, but the results are meaningful. So, and the other place that this really has an effect is with bone density. So anyone who's watched the Tour de France in the past couple years, it's not uncommon for them to get into talking about bone density deficits in cyclists. And that's a problem, because in the event they take a crash or have a fall, they're at that much higher risk for a serious injury. So, if this is something that we can use as an adjunct on top of traditional training, to me, the juice is worth a squeeze on that one. So,
great, yeah. Thanks. So it is suggested that whole body vibration training can assist with recovery, especially in between training sessions, but also after the whole performance. Mm-hmm. So how did you find that to be the case?
Yeah, I think that it definitely has its place with recovery. The research right now is it goes back and forth, and that could very well be a function of methodology of the studies, as well as the specific platforms that are used. When I'm using this for my own recovery purposes, what's important to mention is that I'm using a lower frequency. Mm-hmm. Okay, I don't want to elicit any sort of muscular contraction. I'm trying to basically facilitate my muscles to rebound or recover. So, I'm usually working in the 8 to 10 hertz range, which is just sort of it's almost just a rhythmic oscillation, and that very much makes sense to me, because the muscles act as a pump, and if you're sort of producing this wave-like motion, it seems like reasoning by analogy may suggest that that's going to help to facilitate recovery.
Lastly, considering working with your own patients and their injuries, did you notice which issues benefit from vibration training, and how people respond to this kind of work, especially because it's vibration?
Well, I think that it definitely is something that the more I use it, the more I seem to gain insight into really its indications for certain pathologies or certain patient populations. Where I see this definitely having its place is for residual strength deficits after an ACL reconstruction, for example. Mm-hmm. We know about quadriceps inhibition, or persistent quadriceps weakness, and this is something that may be the stimulus to really, in a safe and effective manner, produce that strength gain that we're looking for, that we may not get from volitional exercise in and of itself. So that's something that I'm hoping that we're going to see the body of research start to really unfold. Now, when I'm using this in terms of working with patients, I love to use it for joint mobilizations. So, and it sort of puts my joint mobilizations on steroids. Things that used to really tax my hands, I can basically get people to do, especially involving the lower extremity, on this and produce a very rapid result. And I also will use this a lot with stretching the calf muscle complex, as well as improving extensibility of the posterior chain. So I think that once we get a little bit more standardized in the plates and the protocols that we're using, that we're going to start to really see this become more commonplace in a lot of facilities.
Yeah.
So,
thank you very much, Chris, for your time and for your opinion.
thank you.
And if you have more questions about vibration training, whole vibration training, please visit the website PT Vibe. It is nearly about to launch, so I hope to see you one day again, and thank you very much.